Well, Happy New Year and welcome to Cityline. This is the first show of 2021, and we are streaming from my kitchen into your home, and it's always great to be with you. We have a wonderful first of the year show ahead of us. Later on, we'll be talking with two individuals that are here to talk about the Dickman Mill Park expansion. Christy and Mark will be here to talk about this beautiful gift to Tacoma, what it entailed to make it happen, and when you can expect to witness this wonderful gift. Symphony Tacoma will be here. Karina will be here to talk about the highlights of 2020 and what they have planned for 2021. Rosemary Panicani. I love her name, but I love her more. She's here to talk about Tacoma Light Rail, something beautiful that she has been a part of to brighten up this winter that we're in. The Humane Society will be here with their Pet of the Week. And then with me right now, for the first time ever on Cityline, I have three wonderful people in one frame with their masks on. I'm talking about Catholic Community Services Family Housing Network. Please join me in welcoming Delmar Algee III. You are the Housing Program Manager for Catholic Community Services. Hello, Delmar.
Hello, Amanda. How are you today?
I am well, my dear, and Happy New Year.
Happy New Year to you as well.
You brought some wonderful friends with you. Alan Brown, you are the Housing Services Director for Catholic Community Services. Hello, my old friend.
Hello, Amanda. It's good to see you.
It's good to see you as well. And this beautiful woman next to you, rounding out the threesome, Patti Spaulding-Klewin. You are the Rapid Rehousing Program Manager for Catholic Community Services. Hello there, Miss Patti. It's good to have you on the show.
Thank you for having me, Amanda, and Happy New Year to you.
Why, thank you so much. So, Alan, let's start with you first. Can you explain just a bit about your agency and the services that they provide?
Sure. So Catholic Community Services provides a variety of services through Western Washington. In Pierce County, the services we provide to people experiencing homelessness are divided into two divisions. We have our homeless adult services, which is based at Nativity House, who also manages the stability site down on the Tide Flats. And then we have Family Housing Network, where Delmar and Patti and I are based, with our services focused on families with children as well as homeless veterans. And we have a continuum of services that we provide that includes rapid rehousing, permanent supportive housing for families, as well as a drop-in day center for homeless families, and our coordinated entry activities, which we are a primary provider in Pierce County in partnership with Associated Ministries.
You know, Alan, you say that so effortlessly, but there is nothing easy about the work that you and your team do, especially as we are in the midst of a pandemic still. And so for you, Patti, how has COVID changed the work that you do?
COVID hasn't really changed what we've done. It's more the practice of how we do it. So we continue to serve our homeless families and continue to house them. We are integrated into coordinated entry, and that's how we get all of our referrals for rapid rehousing. And our team continues to work with landlord liaison and our go-to landlords to house folks. And it has taken us longer to get folks housed because of the moratorium for evictions. The turnover isn't as great, which is a blessing for those that cannot get evicted, but is a little bit more challenging for those households that are homeless right now and staying in their cars. So we love the partnership that we have with our critical time intervention partners and other rapid rehousing programs, because we learn from each other and work towards permanency within a 90-day window. It has taken us longer. Absolutely. We've had some households take as long as 6 months to get housed.
Everything seems to take longer during COVID, and time tends to stand still, and especially for those who are the most vulnerable. So based upon that, Delmar, tell me more about coordinated entry system in Pierce County. First off, what does that mean? And then how does it work?
Sure, Amanda. So our coordinated entry system, it's actually based off of HUD. And so HUD has really a way of having services being provided in each community. And so here in Pierce County, the way that it works is whenever someone says, you know, I'm homeless and I need a little bit of help, I don't know where to turn, the very first professional that they're going to see, chances are, is going to be through that coordinated entry system. So it's going to be a specialist that sits down with that person or that family, and they have a 90-minute conversation that is strengths-based to see if there are natural supports that can help that family or that individual to resolve their homeless crisis that they're in. And so here at Family Housing Network, as Alan mentioned, we are one of the primary providers of that service here in our county. And so we actually do lots of training with other partners, and we do, perform that service often. So we're soon to even expand that service within Family Housing Network and have it available to folks on the weekend, which is a little sneak peek into what we're preparing for.
You know, houselessness is a huge issue here in Pierce County. And Alan, with it being January, it's cold outside. What is being done to help homeless people during these times?
Well, the cold coming on is certainly a challenge for people. I feel like our winter started last March and April, actually, with COVID, and how we had to respond to that. Because, of course, people who are experiencing homelessness are more vulnerable, as they are with the winter cold. And some of the things that started happening that we started doing during that time, as others were doing, was actually putting our most vulnerable folks into hotel rooms. Now, with COVID and many things being shut down, hotels, of course, were suffering, and we were able to negotiate some special rates with folks, and particularly our work with veterans. The VA invested heavily in emergency housing, which ended up being hotel sheltering, basically. So this winter, there's actually greater effort in that going on. We recently partnered with the city of Puyallup, and upcoming we will start sheltering some of the city of Puyallup's most vulnerable in hotels there. Otherwise, there's a great community effort going on as well with our Coalition to End Homelessness in Pierce County. Really trying to think out of the box in terms of what will keep people safe this winter. We've already experienced 4 or more deaths already this winter. And we can't let that go on. So whatever we can do, and there's no perfect solutions, but if we can do things, like expand hotel sheltering, if we can establish safe encampments where people can be, not in an ideal situation, but at least a safe situation. If we can establish more safe parking for folks, where they don't have to be, run off every few days. Those are the kinds of things that we're looking for.
Absolutely. We had Kevin Glack and Coley on last week, and he is echoing, and you are echoing the exact same thing. So it makes my heart feel like we're all collaborating with the same end game in mind. When I hear two different organizations, only different in terms of structure, share the same heart. On that note, Delmar, can you talk about your work with the Tacoma Minstrel Alliance?
Absolutely. And so, there's a lot of simultaneous work that's going on in homeless services here in Pierce County. And, Alan just mentioned our efforts with safe parking and some of the different things with cold weather. But at the very same time, we're doing a lot of equity work. And so not too long ago, there was a certain report that came out, some really quantitative and qualitative data based on people of color experiencing homelessness. And so what happened was Black people in Pierce County make up 13% of the population. However, that percentage increases, almost triple when you talk about homeless people that are experiencing homelessness. And so what Catholic Community Services has done is we've partnered with a group of pastors here in Pierce County called the Tacoma Ministerial Alliance. And as I mentioned before about our coordinated entry system and that specialist that does that light touch work when they first meet with a family. So we've actually trained the Tacoma Ministerial Alliance on how to do that bit of work, but they've trained us on how to really engage and partake in our community in depth and a lot better. So that's just been a blessing. That's been an amazing partnership. And it's one that we think is going to really not just expand our services, but help people, which is what we're here for anyway.
And it's a way to reinforce that community. So the African American community is helping the African American community and building those supports that people are going to need, not just to get housed, but to stay housed.
Yeah, absolutely. Because, we are in the middle of what I think is like a triple pandemic. We have COVID, we have Black Lives Matter, and then we have a housing issue. So the more we can figure out the common threads, the quicker we can find solutions. Patti, I am a daughter of a veteran, and my father had some severe challenges when he came back from the Vietnam War. What are some of the specific challenges serving veterans that are experiencing homelessness that you see, Patti?
Our veterans who we are engaging with currently, and right now we're tracking over 500 literally homeless veterans in our community. And that isn't everybody, I'm sure, because our veterans like to downplay their situation and may not disclose that they have housing insecurities to the powers that be and seek services. So our case managers are finding that our most vulnerable veterans are those that don't share what their needs are until they're in crisis. So we have a lot of silent disabilities that our veterans come with that include mental health, substance use, and other income needs. They will not tell us that they need access to car repairs or transportation. We do, through lots of progressive engagement and motivational interviewing, suss out the need and provide as many resources as we can. However, in Pierce County, we're really fortunate that we have so many programs that are coordinated to try and provide the best care to our veterans at the best time or the most needed time. The other thing to keep in mind is not all veterans are created equal. And I say that veterans are considered a veteran based on their time in service and what their discharge status is. And what we're finding is veterans feel that they're dishonorably discharged if they do not have an honorable discharge. And there are lots of measures of discharge. So if we could just educate our community on that, that would be beautiful. The other thing is not all veterans can seek services at the VA because the VA has very strict criteria. So when in doubt, reach out to the specialists or the people that know so that we can try and help coordinate services as much as we can. And we're happy to educate other service providers in the community about what services are available and how to best help our veterans receive those needed items. Whether it's mental health, substance use, housing, transportation, education, benefits. We do have a benefits specialist on staff that we get to provide benefits to our veterans, as well as a SOAR specialist, which is wonderful, and trying to make a real impact in our community.
It's the least that we can do for the service that they provided for our country. I mean, in my mind, that's a debt that we can never repay. Alan, when we think about 2021, what challenges are coming up in the new year?
Across the homeless serving community, the thing that is looming large for us is what's going to happen when the eviction moratorium ends. We're concerned about, if someone is 6 months behind in rent and suddenly they're owing that 6 months, of course, $600 isn't going to cover it. No. So the impact of that has us concerned. And the continuing concern of being able to protect people from the pandemic, particularly in these upcoming few months where not everybody, the vaccine is out there, but it's not here yet in terms of most people. So the pandemic is getting worse, which not concerns us about the people who are experiencing homelessness, but also the folks that are working with those populations as well. Because if we're losing them to illness, just makes our work more challenging.
Absolutely. Delmar, I've heard of an acronym that is CHIRP, CHRP. What does that mean?
So CHIRP is an acronym that stands for Community Homeless Resolution Partnership. And in 2019, I was on your show, Amanda. That's where we met, and I was very grateful for that opportunity. And we were talking about CHIRP at that point in time, in which we were just launching it. Now that we have just over a year of being into this particular project, we've grown and learned. And so what it does is it's an initiative that we have through Catholic Community Services, partnering with associated ministries as well as our county to broaden the services that we provide. And so what CHIRP does is it's designed to be in areas where services are kind of lacking. And so it's based on, either demographic or, even geographic in certain places in our county. You think of Gig Harbor and Key Peninsula and different places like that. And, Graham, there are people that are experiencing homelessness there as well that are away from Tacoma that maybe don't have that access to the coordinated entry system of someone who is experiencing homelessness right here in our city. And so what CHIRP is designed to do is to partner with community partners, community businesses, and people that see a lot of folks that are experiencing homelessness, and to give them the tools to actually help and to give them a direct connection into that coordinated entry system. So it's just been amazing. We have an absolutely amazing coordinator that does oversee the operations of that and takes care of the different businesses and whatnot. And so we're really excited in 2021 for that to just really launch. We've had some delays due to COVID, of course, but we feel as though that's going to be extremely impactful in this new year.
I love that. So in these last few minutes, I have a question for Patty and a question for Alan. Patty, when you explained the rapid rehousing model, roughly how many families do you serve each year?
Here we are down in our numbers because we have extended our time with our households. Our funding allowed us to go beyond what our normal amount is, just because folks were not working or they were laid off, or there were just delays in general from getting their social security cards to getting their IDs. So collectively in 2020, we have served well over 100 households in that time frame. Not everyone exited to permanent housing, but that is what happens when we work with homeless families. Not everyone is ready to engage, or they happen to get a great job and their income really increases, and we cannot pay financially for them to move into a place after a certain period of time. I won't get into the details of all that, but into the weeds, but we still continue to carry caseloads, 15 to 18 households at a time, and we have 3 full-time case managers doing the work.
Patty, that's so impressive because, when you say 100 families, I want to be clear, that's not 100 people, that's 100 families. So that's numerous people per that one item. So, that makes my heart feel good because it's really hard to think about families living in tents and living in cars. Alan, speaking of that, let's talk about who you would like to thank and also what is the future of the day center?
All right. Well, I want to thank first these 2 brilliant folks that I have working with me. Amanda, I always feel like it's great when I have staff that is smarter than me, and can keep me challenged and help grow what we do. And we have other managers at Family Housing Network as well that are brilliant as well. In terms of our day center, in the next year, we will actually be physically expanding our day center, doing some remodeling. Right now, families can drop in Monday through Friday. We're going to be expanding our hours to weekends as well as later in the evening. So expanding our time when families can come in to cook a meal, get a shower, do their laundry, hang out, get supportive services like case management, get an immediate coordinated entry conversation and assessment. We're going to be remodeling part of our building to make more meeting rooms so that when we can meet more often in person as people get vaccinated, we will have spaces for people to meet, and we hope to bring in other providers of supportive services, whether they be medical, mental health benefits, to have some time in our new space so that families can go right from the day center to say meeting with a DSHS representative, for example.
That sounds incredible. I want to thank all 3 of you and your team for what you do, for the hours you put in, for the sleep that you don't get, and for the prayers that you offer up for those who are houseless and those who are underserved and those who are hurting. And I want to say thank you so much for being here today. And Happy New Year. Please be safe, and much love to you and yours.
Thank you, Amanda.
We appreciate you.